Bye-bye.
Yeah, I think we've gone live. Good evening, everyone, and a very warm welcome from the Herts Essex family. Thank you for joining this open evening, which happens to be the last of the year, a wonderful year that has gone by. So in this open evening, let me see if my slides. Aha, here we go. So what are we planning to do tonight? I will give you an introduction. I will take you through a presentation and give you a little peek into what we do in our center. At the end, we will have a question answer session, and there'll be a link provided for your feedback. In the end, I'll also share a link to the clinic video so you can have a virtual tour. And please do stay with me till the very end, because we've got a special discount offer that I will reveal at the end of the evening. So once again, welcome. Joining me this evening is my wonderful team. I've got Jackie McAdam, the fertility nurse coordinator, and our wonderful Mana Marks, who is the marketing and wellness head. So my name is Praveena Pai. I'm a consultant gynecologist and a fertility specialist. Once again, a very warm welcome to all of you. So, are we good? Yes. So where did we start? So a clinic was founded in 1989. We've got over 35 years of experience and over 8,000 babies to our credit. What I like about this clinic, and I think you will come to appreciate as well, is this state-of-the-art purpose-built clinic provides everything under one roof. So be it fertility assessment, be it procedures like egg collection, embryo transfers, more specialized procedures like PGTA. We've got the embryology lab on site. We've even got the pharmacy on site. So once you enter, you've got everything covered under one roof. Also important is the fact that we are very nicely located. We are very conveniently placed on A10, close to M11, M25, and it's a beautiful area. You know, come just drop in. I mean, not just a virtual tour. Have a drop in. It's a beautiful location. We've got a parking. We've got a lovely canal with lots of ducks to de-stress all of us. Right, what are the services we provide? So we provide fertility assessment for males, females, couples. We also do gynecology screening, so things like endometriosis, fibroid, heavy bleeding. If there's anything not particularly fertility related, but troubling you from the gynecology point of view, we've got that covered. We do treatments such as IUI, intrauterine insemination. We do treatments such as IVF, ICSI, PICSI. I will talk a little bit more about these procedures. We undertake donation programs. So we've got egg donation cycles running. We've got sperm donation cycles running as well. We are one of the leading clinics to undertake surrogacy. And again, there'll be a slide dedicated to this. We also do fertility preservation. So we've got egg freeze, sperm freeze for those of you who want to probably defer starting a family. We, as I said, undertake additional treatments like pre-implantation genetic testing of embryos to screen them and select only the genetically normal embryos. Okay, we offer pregnancy scans. So these could be pregnancies which have happened as a part of our treatment, or it could be some you could have had treatment elsewhere and you're looking for an early pregnancy scan, or it could be just a case of natural pregnancy. So we offer scans at 7 weeks up until 10 weeks. So what is the fertility assessment that we carry out? So we've got couple fertility assessment, which includes 2 visits. We've got female fertility assessments, again, 2 visits. We've got male fertility assessments in which the male will come drop off his semen sample. We also do an HbA, which is not something you normally see. And then the semen analysis results will be discussed via a phone call by an embryologist. Right, so as a part of the assessment, one of the key things that we do is do a very comprehensive pelvic ultrasound scan for the female. So it's a 3D ultrasound gynecology scan, which is very good at picking up problems such as polyps, fibroids. These we know are well known to come in the way of someone conceiving. It also helps us pick up any septums, intrauterine septums, which might come in the way of conceiving, or maybe one of the reasons for recurrent pregnancy losses. This assessment is made even more refined by the use of saline. So we offer something known as saline infusion sonogram, and we can also assess the functioning of the fallopian tubes by a procedure known as HICOZ, wherein we put a dye and we can see it spilling through one or both the tubes. Fit for fertility. Now we know that fitness, I can't emphasize enough, mental and physical fitness is key. So we've got a link on our website about Fit for Fertility, and there is a lot of information available on how to get yourself into the fittest possible mode before you commence treatment. So what's the treatment pathway? So I'm going to take you through a little bit more in detail as to what happens. So to begin with, there are fertility consents which are set up on the platform. You will be sent login details. You'll be requested to complete the forms online. We need some IDs, such as like the passport copy, which needs to be attached to your notes as an identifier. Relevant investigations will then be undertaken for you. You will be guided to download Salve app. Now it's a beautiful tool, and we get a lot of positive feedback from our patients, because by downloading this tool, it acts as a reminder for medications. It reminds you about your appointments, and it's also a secure messaging portal. So late in the evening, you're suddenly not sure what to do with the injection. You think there's been a little bit of spill. What do I do? You can securely message, and one of our nurses will be able to respond to that and put your mind at rest. Once the fertility consents, that aspect is covered, then we bring you in for a pre-assessment. So this is an in-person appointment. You will meet one of our lovely nurses. We organize blood tests. AMH is anti-Mullerian hormone. It's a blood test to look at your ovarian reserve. This is for females. We also do the thyroid function tests. BMI is measured both for female and the male partner. And for the male partner, there is semen assessment. So there is, a semen sample is dropped off. Once these bits are completed, then comes the consultation. So you will be sent a link. We do our consultations via Microsoft Teams, which we found works really beautifully, because partners can be in two different places and they could join us via Teams. So invitation is sent the day before. So do look at your emails, look at your spam. Okay, and what the consultant will do in this is he or she will look at all your your health questionnaires, your blood test results, the semen analysis report, any other details that you would have provided if you've had treatment elsewhere. So we put everything together, and by the end of that 1 hour discussion, we are able to create a personalized treatment plan for you. Screening bloods. So as a part of any treatment, the HFEA guidelines require that we screen both partners for certain infections, which include HIV, hepatitis B, hepatitis C, chlamydia, and gonorrhea. The egg or the uterus provider needs additional screening in the form of AMH, as I mentioned. It's an ovarian reserve marker, and we also look at your rubella immunity status, full blood count, and HB electrophoresis, which is telling me things such as sickle status or thalassemia. Now, these results must be within 3 months of starting treatment. So we try and organize the screening bloods as close to the start of treatment, and they must be done ideally in our clinic, but you can also do it through any other UK accredited laboratory and furnish those results. So let's begin with one of the simplest treatments. So intrauterine insemination is a procedure whereby the healthiest available sperms are introduced directly into the womb via a very fine catheter. Okay, IUI is used to aid pregnancy in heterosexual couples where sexual intercourse may be difficult. It may be because of vaginismus in the female. It may be because of problems with erection or premature ejaculation on the male side. People using their own eggs and uterus with donor sperm. So if sometimes I have same-sex female couple coming through and they want to plan a pregnancy using donor sperms, IUI would usually be the first treatment we offer. Now I will take you through the IVF treatment pathway, and I appreciate that a lot of you who have joined us will be in various parts of this treatment pathway. I mean, there may be some of you who are just about starting the journey, and there are others who probably have had treatment elsewhere, or you've done maybe an IUI cycle and you would want to know a little bit more. So I do apologize to those who probably just wanted an overview. I will be going a bit more into the detail and the science part of it, but at the end I find that being well informed does help. So let's start the IVF treatment pathway. It all starts, so the consultation is done, the treatment plan is ready, okay, and we decide that an IVF is a suitable treatment for you. What happens, the first period that you get, we bring you in for what we call a baseline ultrasound scan. So this happens between day 1 to day 3 of your period, and this is when the hormonal injections will commence. These injections are meant to stimulate the ovaries to encourage the follicles to grow. So follicles are these little structures which have got eggs in them. Okay, they're harboring eggs in them, and by giving you hormonal injections on a daily basis, we are encouraging these follicles to keep growing. These injections continue throughout on a daily basis in the evenings, okay, and they go on right up until your egg collection 2 days prior to that, okay. What can one expect with these injections? So generally they're very well tolerated. We ask you to drink plenty of fluids, close to 1.5 liters to 2 liters every day to cope with these symptoms, and the symptoms one can expect: headaches, mood swings, breast tenderness, bloating. Okay, very rarely there may be features of ovarian hyperstimulation syndrome, but we take the utmost care to try and reduce these risks. During the injections, you will have an additional couple of scans. The first scan is usually around day 5, day 6. Okay, and this is where we start another injection. It's called an antagonist. This whole protocol is known as an antagonist protocol or a short protocol. And this injection is introduced in the morning. Okay, so from about day 5, day 6, you'll be on 2 injections. And what the intention of giving you the injection in the mornings is to prevent you from ovulating prematurely. So we want these lovely follicles to keep growing, but we don't want them to drop the eggs into your pelvis. We continue the monitoring. We bring you back for another scan. Okay, we are also keeping an eye on your endometrium, which is where the pregnancy will implant. Okay, and remember, with every scan, although you will meet the sonographer, who could be a nurse, who could be a consultant, you will also have an additional session with one of our nurses who will take you through the injections, and if there are any other concerns, you'll have the opportunity to have a chat with her. Right, so we've done the third scan, we've looked at the endometrium. On this final scan, we find that everything is looking beautiful, lovely mature follicles, endometrium looking lovely. We give you an HCG trigger, which is the usual trigger that we use. That is giving that final burst of maturation to those eggs. We give you detailed verbal and written instructions on what to do next, how to prepare yourself, and when and how to come in for the egg collection. So that brings us to the day of egg collection. All right, so you are taken inside the recovery bay. You meet one of our lovely nurses who will do the observations. The male partner goes off to provide a fresh semen sample. You meet the anaesthetist. So we've got a lovely group of anaesthetists who provide anesthesia services to us. So you are wheeled inside the operation theatre, you get sedation, so we call it deep sedation. One of the consultants, me or one of my colleagues, will do a transvaginal egg collection. Okay, the follicular fluid with the eggs is now given to the scientists working alongside, we call them embryologists. You are then wheeled out into the recovery, you come out of the anesthetic effect, you've had a nice cup of tea, you've emptied your bladder, the consultant will come and have a chat with you and will give you the initial egg number. So generally you are in the clinic for about 3 hours, and then your partner will drive you home, and we ask you to sort of take it easy that evening. And from there the focus kind of shifts to the embryology laboratory. So what happens here? So day 0 is when the egg collection would have happened. Okay, day 1 is when they will do the initial check to see how many of these eggs have fertilized. Thereafter, it's a day 2, day 3, day 4. Generally speaking, we do not disturb, so we leave the fertilized eggs which we have seen on day 1 in an undisturbed culture, okay, and then straight away have the next look on day 5, which is when we should see a beautiful expanded blastocyst. This is the stage at which we would like to do an embryo transfer if somebody's heading for a fresh embryo transfer. And whatever those fertilized eggs which have not quite reached the blastocyst stage on day 5 are left for another 24 hours. We have the last look on day 6. And to see if any further embryos have developed and they're suitable, they will be frozen. So we have spare embryos. If they're developing, they get frozen on day 5, maximum day 6. Right, so what happens on day 0, for example? So there's been egg collection. If somebody's come for egg freeze, then this is the day we collect the eggs, we have a look and see how many of these are mature, and we freeze the eggs. So I think some of you might know about egg freezing. So this is a reproductive technique used for fertility preservation. HFEA has now increased the limit of storage from 10 years to 55 years. The younger you are at the time of egg freeze, the better the competence of these eggs to give us a fertilized, give us a beautiful embryo when they thaw. Egg freeze may be undertaken for social reasons, may be undertaken because somebody is anticipating going into early menopause, or they may be anticipating losing their egg reserve due to chemotherapeutic agents because of cancer or surgery. Okay, there is enough information available on our website on HFEA, and there will be counselling offered before anybody commences an egg freeze cycle. On day 0, we also do insemination. So the eggs which have been received will now either, which now need to be fertilized. So we could do that via IVF, or we could do it through a procedure known as ICSI, or another procedure called PICSI. So IVF is if all the semen parameters on the day of the egg collection are completely normal, they meet the criteria laid down by the laboratory, then each egg is now left surrounded by a few million sperms in the petri dishes in the incubator, and they will be checked 24 hours later to see how many of these are fertilized. So this is known as IVF, in vitro fertilization. In vitro means fertilization outside the body. All right. ICSI, on the other hand, is where the embryologist will give the sperms a hand. So if the semen parameters are low, it could be low count, low motility, or more abnormal forms. Or if you've had to remove sperms or retrieve sperms directly from the testis, these are precious, they don't have the ability to fertilize on their own, they need to be injected. It could be because of the semen showing lots of antibodies which are causing clumping of the sperms, okay, and we may need to select the sperms ourselves and inject into the egg. Or it could be if someone's had a previous IVF cycle and did not have an adequate fertilization rate, we automatically will then fall back on ICSI. Okay, so love this video. So this is a video of how an ICSI is performed. It's a very fine, very refined technique. You can see a pipette which is being held by an embryologist, and what you're seeing is a highly magnified picture because the sperms, eggs you're looking at, the size of these is in microns. So you can see lots of, you can see this lovely sperm here. Yeah, it's got a head, it's got a tail. So what the embryologist is trying to do is, here we go. Yeah, we have immobilized. Yeah, we've cut off the tail of one of the good sperms, yeah, which sounds a bit brutal, but needs to be done. It's now been aspirated into the pipette, okay? And then what happens, you can see this beautiful egg which is being held by a holding pipette. The ICSI needle, which has got the sperm within it, is now being gently, there we go. We've got this nicely positioned sperm here, okay? The needle is now going to penetrate the zona, enter the egg. It'll aspirate a little bit of the cytoplasm into, and then very gently, it's going to expel that sperm into the egg. There we go. And the needle is now removed, and voila, the journey begins. ICSI. Right, and last but not the least is PICSI. So if we found that in the semen, a lot of the sperms are showing immature forms, we want to do an additional step known as PICSI, whereby we will do an HbA testing and select only the mature sperms and then inject into the mature eggs. So this aspect is known as PICSI. Right, so then comes day 1, as I mentioned. Okay, that's when embryologists will see the eggs which were inseminated either via IVF or ICSI. What have they done? Okay, what they want to see is a normally fertilized egg, which looks like this, which has got these 2 row nuclei. Okay, the nuclei, one from the egg, one from the sperm. Okay, so you will get a call to tell you how many eggs are fertilized. So for example, if we had collected, let's say 15 eggs, 13 of these were mature, 13 were injected, ICSI procedure done, and next day you get a call to say, look, out of those 13, I'm very pleased to say that 11 have fertilized, are beautifully fertilized, and that's the fertilization rate. Okay, not every egg will fertilize normally. We may have a few abnormal ones showing 3 PNs, and that is the normal course of events. Not everything has the potential to develop normally. Thereafter, as I said, I'm not going to take you through too many details of this. We've got day 2, day 3, day 4. So generally speaking, the formula is this. If you've got 3 or more eggs which are fertilized, we leave all of them in an undisturbed culture. We don't have another look, and we will straight away have another look on day 5. You will be in the meantime prepped for a fresh embryo transfer if that's suitable, and we bring you in for the embryo transfer on day 5. All right. Rarely, if let's say only 1 or 2 eggs are fertilized, the potential of those making it to day 5 is very small, and in those situations we may have to bring you on day 2 or day 3 and transfer maybe a 4-cell embryo or a cleavage stage embryo. Okay, but that's usually a rare situation. The day of the embryo transfer, this is what you will get to see on the screen as well. This is a beautiful blastocyst. You can see a little bit of hatching happening as well. So this single layer of cells is called the trophectoderm, which is going to form the placenta. And this little clump of cells is the one which is going to form the baby. It's called the inner cell mass. Okay, so the beauty about our clinic is we've got the lab functioning 7 days of the week. So embryo transfers consequently can take place even on Saturdays and Sundays, which means we are maximizing your chances of pregnancy. Okay, you will get an opportunity to see the embryo on the screen. You will get a little picture to take away if you're into journaling. Okay, embryo glue is something we offer as an add-on in the clinic. It's a transfer medium which mimics the conditions in the uterus in order to help the embryos implant better. Rarely, some couples decide not to have a fresh transfer, and they may decide to test or screen the embryos by doing an embryo biopsy. Okay, and so this service is known as, or this technique is known as PGT, which stands for pre-implantation genetic testing of embryos. If you're doing it to screen embryos for chromosomal normality, then it's called PGTA. If we are doing this to screen for any monogenic disease which runs in the family, such as cystic fibrosis or BRCA or Huntington's disease, then it's called PGTM. Okay, and we also have another a technique known as PGT-SR, which stands for structural rearrangements, and this is something which can also be arranged. Embryo freezing. So let's say we bring you on day 5, we've done a fresh embryo transfer because you've not, decided not to go for PGTA, but many times we have spare embryos which can then be frozen. So any embryos that have not been transferred and are suitable for freezing will be frozen on day 5. Any spares which have the potential to grow are left till day 6, and that's the last day we freeze the embryo. So that's embryo freezing. Okay, and thereafter you are sent home. Embryo is transferred. You will be the pregnancy supported with luteal phase support, as we call it. That includes pessaries, cyclogest pessaries, which you are advised to take vaginally or rectally, and you might or might not have an additional injection. Okay, if it's a fresh embryo transfer, you are given a date a couple of weeks down the line to do a urine pregnancy test. If it's a frozen embryo transfer, then we arrange a blood test through the clinic. And that's the one hopes that every cycle culminates into this this happy happening, which is a positive pregnancy test. And once it's a positive pregnancy test, generally we arrange the first early pregnancy scan at approximately 7 weeks in our clinic. Provided we've seen a beautiful pregnancy, you can see here's a nice gestational sac, you've got a lovely yolk sac, you've got a beautiful fetal pole with a nice, I'm sure, a lovely heartbeat. Okay, we then give you advice on how to wean yourself off the luteal phase support, and then we kind of say goodbye at this stage and send you down the NHS route to book your antenatal visits. Okay, we do have the option of booking another scan at 10 weeks if you want, and we can also offer you NIPT, which is a non-invasive prenatal testing to look at Down syndrome and a couple of other chromosomal abnormalities. Moving on, so that was a sort of a whistle-stop tour through an IVF cycle. As I mentioned earlier, we also undertake egg donation and sperm donation. So egg donation could be for somebody who has, seen depletion in her ovarian reserve because of age. Somebody's gone through early menopause, so menopause coming before the age of 40. It could be a lady who's dropped her ovarian reserve either because of any gonadotoxic chemotherapy, or she's had a few cycles and realized that she is not producing competent eggs and therefore decided to go with donor eggs. Some women sadly are born without ovaries and they have to rely on egg donation. And then of course there is surrogacy, wherein, especially if it's two same-sex males, they will use donated eggs and use their own sperms, create embryos, and then embark on a pregnancy via a surrogate. Okay, sperm donation, similarly, it could be because somebody doesn't produce sperms, or they've undergone chemotherapy, or they may have genetic disorders which is affecting their sperm production, and consequently they need to use donor sperms. It could also be a case of a single lady planning a pregnancy, so she wants to be a solo mom. She could use donated sperms, or same-sex female couple using donor sperms either through IUI or IVF. We've got a sperm bank. We've also got liaison with other sperm banks. So, and we also have a full-fledged egg donation program running in our clinic. That brings me to surrogacy. So, as I said, we are we are the leading clinic as far as surrogacy is concerned. We have done 355 cycles since 2012. We've got a dedicated surrogacy team. Many cycles, as I mentioned earlier, also include an egg donor. So surrogacy could be undertaken by a heterosexual couple. It could be a male same-sex couple. It could be single people using their own gametes, but somehow they can't carry a pregnancy and they would like to borrow a womb, as I call it, in a surrogacy arrangement. Okay, the types of surrogacies are host surrogacy and straight surrogacy. What we do most these days is host surrogacy. We also liaise with NHS, as in we undertake a lot of NHS funded cycles. So we have got contracts with 3 integrated care boards. We've got the North East London, Mid and South Essex, as well as the North Central London. So if you think you are on the NHS waitlist, for example, or you think you're able to get NHS funding, do contact your GP. You have the ability to choose clinics, and if you find Herts Essex works for you, is close by, you can choose, and we can carry out an NHS funded treatment cycle for you in our clinic. And if there is no NHS funding and you find that the expenses are prohibitive, which I absolutely agree can be, okay, there are some other ways. So we do have programs like the egg share scheme and the sperm share scheme. So, for example, if it's an egg share scheme, if you think you fulfill certain criteria, you have to be of a certain age, you have to have certain ovarian reserve, then you could potentially be undertaking an egg share cycle, which essentially means we stimulate you. The eggs which are then collected, half of them can be used for your own treatment and the other half are donated to the egg bank, and that significantly will subsidize your treatment costs. So if you think that's something which appeals to you, by all means, write to us, talk to us. We can give you further details about the egg share and the sperm share cycles that we undertake. And here we are. So we've got this special offer, new consultation, which is generally priced at £250. If you book this before or on or before 13th of December, which is a Friday, then you can get it at a discounted price of £125. This price does not include the cost for the blood test and the serum analysis. So that's the 50% discount, which I have now revealed. We have partnered with some of the other bodies which provide funding options. So we've got a partnership with Access, we've got Gaia Fertility, we've got Assured Fertility. Please do have a look. There's information provided on their own websites as well as links provided on our website about the funding options. I find this slide extremely important. I think emotional support is a key element, which I'm proud to say at Herts Essex is something which is extremely important in all our dealings. We know that it's an arduous journey. We know that not every couple or every person who walks in will go home with a baby. We just are not in that position. But what we know, what we want to do is to make this journey as less stressful and as pleasant as possible. So you'll find plenty of support as you go through treatment with us. There are lots of information available on the website as well. All right. We talked about fitness. We've got a lovely dietitian, Alex, who's liaising with us. So if you need any specific dietary advice, be it trying to reduce your BMI, PCO related dietary advice, please contact her and she'll be more than happy to help. So why us? There are lots of fertility clinics around the country, maybe lots in your region where you live. All I want to say is that we've got experience. We've been here 35 years and doing good work. We are available 7 days a week for embryo transfers. We've got electronic witnessing system, so there is no fear of mixing of your gametes in the laboratory. It's a very, very strictly adhered to protocol, the electronic witnessing system. We've had more than 8,000 lovely babies delivered. You will find that you are supported, not just in your medical, not in just the medical aspects of your treatment, but even emotionally throughout your journey. Okay, and then of course there is free parking. So that brings me to the end of this presentation. There will be a link provided to you, so please, please, please let us have your feedback, because it is crucial for us to further streamline these presentations. So thank you very much for that. You can follow us on social media. If you want to book an appointment, you've got the telephone number. You can drop in an email at the enquiries@hertsesexfertility.com. New consultations are generally available within 1 to 2 weeks, although I must say somebody whispered into my ear earlier that we are filling up quite quickly. So no, but we will do our bestest to try and get that consultation for you as quickly as possible. I'm sure you've been writing questions, and maybe Jackie's already been answering those, but yeah, please, if you've got any question answers, I'll be around. Jackie is here. We'll try and answer as many as possible. But once again, I wish you all a lovely Christmas and a nice New Year. Thank you very much for joining us on this open evening. Okay, before you go, I'm just going to put up the virtual tour of our clinic. I'll provide that link, but I just wanted to also say a huge thank you for being a part of this evening. Bye.